Physiology notes of all my theory videos is available now. To get your copy, you can WhatsApp on 72650 This book attempts to come up with important questions and appropriate answers in easy way. In this book, different systems are discussed under 10 sessions, and each section is framed with different topics in the form of question and answers. It provides thorough coverage of subject and made it easy to write down answers in the exams. Hypoactivity of adrenal cortex. Here it is also of two types, primary and secondary. So primary adrenocortical deficiency. Here you can see that primary means the cause is there in the adrenal cortex. There is decreased secretion of adrenocortical hormones. Okay, and because adrenocortical hormone secretion decreases, then ACTH inhibition is lost and therefore ACTH level is high, and commonest causes are Addison's disease and congenital adrenal hyperplasia. Whereas secondary adrenocortical deficiency, what happens here, there is decrease, you can see here, this is primary, here deficiency is there in the adrenal cortex, whereas in secondary what happens, ACTH is reduced, or you can say tertiary CRH secretion is reduced. So when ACTH decreases, which in turn decreases secretion of adrenocortical hormones. But here what is the difference between primary and secondary? In primary adrenocortical deficiency, all the adrenocortical hormones, mineralocorticoids as well as glucocorticoids, they are reduced, whereas in secondary adrenocortical insufficiency, because ACTH affects only glucocorticoids, then glucocorticoid secretion decreases. Okay, so here only symptoms of glucocorticoid deficiency, as we have discussed, electrolyte balance is normal, plus because ACTH is there, most of the time it is associated with pituitary deficiency, so other endocrine glands functions, they are also affected. Another thing is ACTH decreases, so skin pigmentations, they are absent. Now very important one, Addison's disease, which is chronic form of adrenocortical insufficiency. Okay, here there is chronic deficiency of adrenocortical hormone. There is decreased secretion of both glucocorticoids as well as mineralocorticoids. Okay, now which are the causes, important causes of Addison's disease? First, that is primary atrophy of adrenal cortex, which is because of autoimmunity against adrenal cortex. Autoantibodies are produced, they destroy adrenal cortex, which is responsible for 80% of causes of adrenocortical insufficiency. Second, if it is because of some infection like tuberculosis, fungal infection, cytomegalovirus infection, that also destroys adrenal gland. After adrenalectomy, if we have not given glucocorticoids and mineralocorticoids, then also this situation may occur. Malignant tumor may affect the hormone secretion, and another cause is Waterhouse-Friderichs syndrome. Here severe infection and hemorrhage, and that results in suppression of the adrenocortical functions. Now which are the symptoms? Symptoms are because of decrease in the mineralocorticoid and glucocorticoid secretion, and there is increase in the ACTH secretion because negative feedback effect is lost. Now which are the clinical features? You can see absence of mineralocorticoid and glucocorticoid, both are absent, so there is hyponatremia, sodium level decreases, hyperkalemia and acidosis. Hyponatremia, along with that, there is decreased extracellular fluid volume, decreased plasma volume, decreased cardiac output, blood pressure also decreases, and if the patient is not treated, the patient will die within 4 days to 2 weeks. Now, so this is because of lack of mineralocorticoids or aldosterone, lack of glucocorticoids. Which are the clinical features? They are, you can see here, blood sugar level decreases, hypoglycemia, decreased mobilization of proteins as well as fat, muscles, they become weak, depression of metabolic functions, certain metabolic functions are depressed, energy mobilization is also reduced, susceptibility to stress as well as infection, and if the patient is not treated, he will go in Addisonian crisis, we will discuss. Blood picture, here there is eosinophilia, lymphocytosis, neutropenia and anemia. Along with that, the patient is having hypersensitivity to taste and smell sensation and showing of alpha activity in the EEG. Along with that, because as we have discussed, cortisol secretion decreases. Okay, so negative feedback effect on the ACTH is lost. So what happens? ACTH secretion increases, and ACTH has 1/100th time of beta MSH like activity. So what happens? This ACTH produces skin pigmentation. Now which kind of pigmentation? Either there is tanning or vitiligo, you can see here. Sometimes pigmentation present on the scar. You can see here scar pigmentation increases. Pigmentation at the skin creases. You can see here creases at that places there is pigmentation. Then darkening of areola here, pigmentation of pressure points here, and pigmentation of gums. So these are the clinical features. Now another important thing is Addisonian crisis. Now what is this? Crisis itself suggests that it is an emergency. So this is acute form of adrenocortical insufficiency. So that is chronic form, that is adrenocortical insufficiency. Here adrenal cortex is not functioning. Okay. Here what are the cause for Addisonian crisis? Number one, we have removed adrenal cortex, so we don't have any glucocorticoids or mineralocorticoids. Second thing, we have withdrawn glucocorticoid therapy. So glucocorticoid therapy which was we were giving previously, if suddenly we stop glucocorticoid, then the patient is not having glucocorticoid secretion of his or her own. Okay? And third cause is if the patient is having sudden stress or infection or surgery or any kind of stress, then at that time cortisol secretion required to be increased, but it is not increased because of Addison's disease, and that results in circulatory collapse and death. This is known as Addisonian crisis. So in Addisonian crisis, large amount of glucocorticoids are required to be secreted in patients having stress like trauma or disease or surgery or any other kind of stress. But these glucocorticoids are not secreted, and that results in Addisonian crisis, which is characterized by decrease in the blood pressure, decrease in the blood sugar, and the person will go in collapse. Diagnostic test, how can we diagnose? We can diagnose with the plasma cortisol level, aldosterone level, both are reduced, blood glucose is low, sodium is also low, potassium level increases, and ACTH level may be increased or decreased depending on the situation. Suppose ACTH level that is decreased if there is insufficiency of anti-pituitary, and it is ACTH increases if there is insufficiency of adrenal cortex. Now treatment, here we can give glucocorticoids and mineralocorticoids. Oral prednisolone is given. Doses are 20 mg in the morning and 10 mg in the evening, and aldosterone is also given, that is fludrocortisone 0.05 to 0.1 mg daily, that is for the maintenance of electrolytes and water.